The most common facial procedure is absolutely upper eyelids. Then we have facelift, which is pretty common and becoming more common nowadays. Then we have brow lifts, which means lifting of the eyebrows. We have frontal lifts. Then, of course, rhinoplasty, which is a nose job. Unfortunately, I don't do rhinoplasties anymore. I used to do it for many years, but now I do it only in special occasions. And then one relatively new thing to do is the shortening of the upper lip, which is a relatively small procedure. Well, the most typical patient is a woman of, let's say, 35 to 65 years, usually asking for eyelid surgery or facelift. And if they ask for facelift, the usual question is correcting of the neck. Facelift term in English is actually called neck lift. And this is the most common part to correct, here below chin and the lower face as well. With age, after 50 years, we usually get some extra tissues here and people want to get rid of that. If we want to do more extensive facelift, so then we go to mid-facelift, which is this part. We can go for also upper parts to do the brow lift or forehead lift at the same time. When a patient comes in, I don't first pay attention only to eyelids, so we always analyze a little bit wider. So I ask the patient to lift the brows, and the usual home test is like this. In front of the mirror, you try to lift your brows. If this is just 1 centimeter or something small, you don't need any brow lift or frontal lift. But if this moves several centimeters, then it's probable that eyelid surgery is not enough. You need to have something done in the forehead or brows in addition to eyelid. So we go through all these possibilities with the patient. This is also a very common question. So people are a little bit confusing what is lower eyelid and what is mid-face. Lower eyelid means just some extra tissues here below the eyes. They may be bulging of fat, or there may be a groove here between eyelid and the chin. Sometimes the patients are asking that can this part be lifted? It can, but it's not anymore lower eyelid surgery, it's mid-face lift then. So lower eyelid surgery is only for eyelids, and we have to remember it's a little bit more complicated than upper eyelid surgery, and we have to avoid extra tightness. So it's not the aim to make lower eyelids very tight, because it may cause problems sometimes like this, and we want to avoid that. We discuss about different combinations which are suitable for patients before deciding what we are doing. We go through all the suitable possibilities which the patient might have. So basically, lower eyelid surgery is not more vulnerable than upper eyelid surgery if we pay attention and know exactly what we are doing. So the main idea is, or question is, to remove excess skin. But there may be other things as well. Usually there may be some bulging of fat in the lower eyelid, or there may be a groove between the eyeball and mid-face. So we always have to be careful not to tighten the skin too much. Sometimes patients are asking for it, but that should not be done, because it may lead to excessive tightness of the lower eyelid, which may lead to that kind of situation which we want to avoid. Facelift is not one procedure. It's a selection of different procedures that the correction is focused on the neck and lower face. So that's the most typical thing the patients come for appointment to ask for. We can do that. That's done practically every time. But if we want to have something more or do something extra, so the next thing is mid-facelift, which means that we are lifting the tissues in the mid-face, in the cheek area. Then we can do at the same time, we can do upper or lower eyelids, and we can even extend the surgery into a forehead if we want to. But we don't need to do all of them at one stage. We can separate them and do only what the patient needs. Well, I would say the goal of the facelift is to make appearance more youthful. The meaning is not to get rid of wrinkles. Wrinkles can be stylish no matter what the age is, but we want to get rid of extra hanging tissues in the wrong places, typically in the neck and cheeks. So in my opinion, any good candidate or even the best candidate is a person, woman or man, with not too thick layer of fat in the face and cheek areas. So we can do a facelift on a person with a round face and thicker layer of fat, but the result is absolutely less pleasing than in the persons with the less fat in the face. What is important, in my point of view, is that the patient is a non-smoker. Heavy smoker is a danger. Heavy smoking may cause healing problems in these areas, which is not, of course, optimal. So smoking, besides causing healing problems, it also diminishes elasticity of the skin, and in long term, so the result will not last as long as it would be in a non-smoker. Well, the basic plastic surgery training I have had is mostly from Helsinki, Finland. But what has been the best thing since that was the period of training in Dallas, Texas, and in Mexico City, where I have learned a whole new concept, and this is to plan the dimensions and proportions of the face. And this means doing a little bit more surgeries on the bone of the face. I'll show you some pictures to understand that. Hey, here are some of my patients where I have been doing surgery into the bones of the face. Here is a teenage girl, and everybody can see that the upper jaw in this area is behind. There's some problem in this area. So this is the same girl in spite of the difference in hair color. So we have shifted forwards the upper jaw, which makes a complete difference in the face, and the whole face is more balanced. This is another patient, again, the same patient before surgery and then 1 year after. It seems that the nose is very big, and also there's a discrepancy in the lips. Upper lip is behind and a lower lip is bulging. So here we have done the same thing, shifting the upper jaw forwards, and it will change the whole situation. Another teenage patient, the same problem, not ability to show teeth when smiling, and we have changed here, shifted only the upper jaw in front, and then we have adjusted the smile line so that smile becomes optimal. This is the very important step of the procedure. And this showing the teeth is called dental show. Any patient or any normal individual who has the lack of showing teeth when smiling should come into consultation. What is the problem with that? Very often it's a question of problem in the bones, not in the soft tissue. And if we correct the bones, we can adjust the dental show as optimal as we want to. Well, I do the other plastic surgical procedures, the common ones, like everybody else. So this includes breasts, augmentation, reduction and tightening of the breasts, abdominoplasties, liposuctions, and even some gynecologic operations. Well, the biggest reward is happy patient, a patient satisfaction. That's the most important thing because it makes me feel good. But I would say that I'm always motivated. I have no problem with the motivation. And I'm ready to use more time with the patients than I have seen many colleagues do.